So hi people, welcome back to our channel. We are so glad to have you again, and we have a whole new different video.
Today we can talk about bipolar disorder.
Yes.
It is among the common mental illnesses in our country and the world at large. People have heard about it. Some have tried to diagnose themselves with bipolar disorder, which is not good. So as I start, I always like telling people that those people who say I'm bipolar, some have even turned to use it as an excuse, which is not good.
Or to refer to yourself as a character, as a personality.
Some,
yes.
I've had some referring themselves or trying to use it as an excuse that their behavior, it is because of this. I want to say that is not true. Bipolar disorder is a problem of the mind that should be diagnosed in a health facility. You should not self-diagnose yourself with the same, because there are other conditions that mimic that one, like what we call cyclothymic disorder, or even other behaviors that may not meet the criteria to diagnose the bipolar disorder. Bipolar disorder previously was used to be referred to as manic depressive psychosis. It is a mood disorder. We actually call it bipolar mood disorder. It affects the mood. We have mood swing to different extremities, whereby you may experience extreme lows, what we call major depression. You may experience highs, where you may be in a mania or hypomania. But we have two types of bipolar disorder.
Yes.
We have bipolar 1 mood disorder, whereby we have patient or people presenting with the symptoms for around for around 1 week or 2 weeks, whereby they may present with mania. Mania, these people may present with disinhibition. That is whereby the patient or that person may even put off their clothes.
Yes.
They may start singing.
I have seen the putting of clothes in Nairobi street. Unapata mtu ametoa nguo anatembea.
Yeah. They may be disoriented with time and person. They may not even know who they are when they're in mania. They may be socially withdrawn.
So socially withdrawn means you don't want to be among many people.
Yeah.
You want to be alone.
Yeah.
Yes.
They may do some behavior that is not their usual behavior, like involving themselves in risky activities.
Yes.
And this may harm them. They may also lack sleep. They may be walking around even at night,
Yes.
And this episode may be followed by hypomania, whereby now this person is very active, hyperactive. They are talkative, highly talkative. We call it pressure of speech. They may be have a latent mood, whereby they seem wamechangamka sana, na hata wakiongea they talk in a high volume or high pitched sounds. Some even screaming, and running all over, their mood is latent.
Yes.
This may last. They even may multitask. you find someone is doing an activity and another one, you know.
Which they can't complete.
Yeah, after some time you realize one has failed. They may make some decisions that may put themselves at a risk. Some may even start a funny business. You find them selling things you can't imagine they can be sold.
Yes.
You know, their behavior shows they are in a state we call, on an episode we call hypomania. After a week or so, these people who are not even sleeping, and remember they can have an increased appetite or low appetite.
Yes.
Some may not have time to eat. Some are eating a lot. After 2 weeks, you find them again, they are down. They are withdrawn.
Yes.
They are not getting out of bed. But even if you follow them there, they are not getting sleep or enough sleep. They don't want to associate themselves with the family members or other friends. They feel guilty and unworthy. They feel suicidal.
Yes.
Others, they can't enjoy it. They can't even go to work. And now this episode may also last for some time.
Yes.
Another type of bipolar disorder is the one we call bipolar 2 disorder. That one has only 2 episodes.
Yes.
Whereby we have hypomania, the one I have explained, a latent mood, hyperactivity, pressure of speech. They are talking too much.
Yes.
Even when you try to intervene in their conversation, they can't give you time. Wait, they are talking too much.
Yes.
That is what we call pressure of speech. This episode will be followed by a major depression. So some people who try to self-diagnose themselves with bipolar disorder are those people who have mood swing. Sometimes they feel they are bitter, they are sad, all of a sudden they are very happy. You know, there are people like those.
Yes.
Even in marriages, there are people like those, and this problem affects marriage. So that you find you are sitting in a sitting room, someone walks out, when they come in, you are happy, but now you are sad. You wonder why. You know, it brings a disagreement between the couple, and some who may not turn up or go to a health facility for assessment or for psychoanalysis to understand who has a problem, it predisposes them to challenges in marriage.
So basically it has stages. It has a way it comes slowly as it takes over someone.
Some of these people, when before this condition is much, you know, they will try to now indulge in drug abuse.
Yes.
Others will try to manage it. After some time, they are not able. Yeah, it may take some time after or before the problem is now takes attention of the relatives. Yeah, but even before it is a problem of attention by the family members, you realize that these people have had the symptoms for quite some time.
Yes.
Whereby people thought that this could be their nature, and this is their. It is normal. It is okay with them. That's how they are.
Yes.
Until when now, maybe the problem continues to affect them.
Well, what I'm getting is someone can have this change of behavior for some time mpaka watu wa familia they get used and they say I think Remy has changed and now that is him, such that even when your condition is worsening they won't realize, they'll say normally squeezy, that's how she behaves.
Others will also think of pretense.
Oh,
this person is pretending. How comes at this hour he or she is crying?
Yes.
After some time he is there laughing.
Oh, okay.
So they may think of the patients to or think that they are pretending, or think that it is their decision to behave in this manner,
the way they are,
or think that maybe that is their new lifestyle.
Yes.
And this is the reason why there will be no one in the family deciding to or are recommending them to go for checkup.
Yes.
Again, these people with bipolar disorder, some of them also will have insight, others will lack insight. Some will try to manage this problem with drugs of abuse like alcohol. They may be aware that my mood is swinging.
Yes.
My mood is high and some other time is low. So when it is low, they try to bring it back.
Yes.
They think that alcohol may solve the problem. They mask the symptoms. Others get complication upon exposure to drug abuse, and this becomes
a challenge.
Yes.
A big challenge.
Yes.
I am loving this conversation, especially the way we take stress. So is me niko na stress. Like personally, when I have things that are bothering me, I honestly say it straight away. Me niko na stress, yeah. So maybe daktari, are there some people who are able to manage themselves in person? Because stress is the one that leads to depression, right? So you find there's something that is disturbing you in a group, mpaka inakuwa depression. Am I right? Ama depression and stress, are they two different things or one leads to the other?
It's a good question. It is a good question.
Yes.
Stress is not depression.
Yes.
And stress, there is, as I said, when you study about these things, there is no clear indication that a certain thing can lead to depression or other mental illness.
Yes.
But we say we have factors predisposing us or predisposing people to mental illnesses. So stress may be a factor that can predispose one to a certain, and mental illnesses like depression.
Yes.
Stress, you realize again, someone will be living a very stressful life, but they will not fall into depression.
Yes. Actually, I think that's what I was asking.
You realize another person, something you may perceive a minimal stress is predisposing them to a certain mental illness like depression. Now, the thing is that, as I said, there may be two or more factors that is adding up to a greater risk to a certain illness.
Yes.
Like for example, this person who is exposed to minimal stress and is falling into depression might have another factor of the history of the depression or other mental illness in the family.
Okay. Yes.
Yeah, as I also said, our bodies are different. You find someone somewhere is strong enough to manage some stress or some trauma in their life. Someone elsewhere is not able. So it is the factors and then our many factors added up together that can give us a clear indication of what is causing this problem. Yes.
Wow. Wow. Okay. I get. So maybe what is the future with this mental illness, Daktari? What do we do about it? How can we address it in a more easy way to help more people? Maybe get treatment, get diagnosed, and get help, because I think it's really increasing, and there are so many people that are suffering, even without knowing. So what is the way forward now, after all these things, after all the myths, after all the risk factors with this mental illness? What is the future? What can you say we can do to help, even create more awareness? Maybe, I don't know. What from where you sit, what do you think can be done, at least to fight mental illness?
That's a good question. I think all parents, all grown-ups, regardless of your candor or your profession, including teachers, the clergy, every other person that can hear such a message about mental illnesses should take a responsibility of passing it to another person, like their children and or their students or pupils, because we have to share these things about mental illnesses. Of course, like for example, even if we said that there is no clear cause known to resort to mental illnesses, like malignancies or cancers, we have been taught about predisposing factors,
Yes.
and that is what we set to act avoiding the predisposition. Also, in mental illnesses, of course, you will have people who are not using drugs of abuse, but they have mental illnesses.
Yes.
But you have those who are using while having the problem, and others who are using and falling into mental illnesses. We need to protect all we can, to protect ourselves the way we can, to avoid the things we can, to reduce the factors that can predispose ourselves to mental illnesses. Like for example, drugs of abuse. You can live your normal life without taking alcohol, but if you take alcohol, you can get a problem along the way.
Yes.
So that one you can stop. You can live your life without marijuana. You can live your life without cocaine or heroin, but with the usage, you can fall into other mental illnesses. So you better avoid these things. Of course, you can't change if there is a history or a trait in the lineup or in the family. But these other things, you can avoid them. And when you feel I am having a problem that maybe could be solved by a drug of abuse like marijuana or alcohol, that is the very time that you need to come for help, for advice, for help, be it medicine or counseling. That's when you need to seek help. But if you lean onto your own understanding, you will never solve it. You will only carry it forward, mask it, or complicate it. Yeah. So it is our responsibility to pass this message to our children at home, at school, in the churches. It is everyone's responsibility, because you realize even if the government maybe facilitates treatment like it does to other illnesses like HIV, without our commitment to this, without our input, the government can't protect us from these problems if you are not committed to do it. So it is our responsibilities, even to those who have ears and get the message but ignore it. Yeah. So everyone should take it as a responsibility and know that when you get a mental illness,
Yes.
you may suffer stigma even after healing. You wonder, some people are saying that, I am insane. So I will not even be able to talk in front of people. They will say I'm insane. I can't tell them. This is now the time to know that the stigma also is something that can affect the rest of your life. So it is better to avoid these things that can predispose you to the illnesses. But I would like to say that about this stigma now, it is not good to attack someone or to despise them because they've had mental illness, because you never know. Also, you might have suffered it before, you might be suffering from it, you might suffer from it. So you should not ridicule someone who is mentally ill or who has been diagnosed with a psychological problem. It is not their will, it is not their what they wanted to happen in their life. It is just a problem of an organ of the body we call brain.
Yes. I have gotten that point where you are really separating that brain is still an organ. Like the way you can, suffer from a kidney, a liver, my heart is spinning, the same way the brain can. Daktari, as we finish, you can go to hospital na uangaliwe roho, uambiwe style uko sawa. You can check cancer, you can have breast cancer checked. I mean, your body organs, all other body organs can be checked. Na for no reason. Naweza kuja hapa nikwambie daktari, I want you to check me. Is there any checkup for mental illness where I can walk in the hospital and say, I want you to tell me if I'm okay in my mind?
Thank you. That's a good question. And that's a good question about investigations or laboratory workup done to diagnose mental illnesses. But basically, what we do, we call it psychoanalysis. We access you, we interrogate you, we share, and that's when we are able to know what state of mind you are in. From the laboratory workup and even imagery, where you have scans of the brain done, MRI, CT scan, echo, EEG. We may find few findings. We may or may not find anything. And basically, investigation from imagery and from laboratory workup may show nothing. And that is actually another challenging factor towards treatment or towards acceptance, because they say he has been tested, nothing sure. He has been scanned, he had a scan done, there is nothing. Of course, sometimes we may find some tumors of the brain which may result to mental illnesses. Sometimes we may find some problems when we do EEG of the brain. We may find some electrical alteration which indicates some problems like epilepsy. But generally, for many mental disorders, we may find nothing, because the chemicals involved in these problems are very minute, very small. Even some microscope may not see this. The serotonin, the neurotransmitters, these are the dopamine, they may not find anything. In just less cases that we may find a test showing something that may indicate like thyroid. Sometimes we may find some imbalance of the three thyroid the thyroid stimulating hormone, the T3, T4, where there is an imbalance, and sometimes this problem of the thyroid affects the brain. In less instances, we find something from laboratory workup. Even in pubertal psychosis, you find someone has delivered a kid in the first 3 months. They develop a problem called pubertal psychosis. Sometimes you may investigate, but there's nothing. Just because of the hormonal impact, hormonal changes, this could affect some glands and affect the brain. Sometimes you may test this, find nothing. So we don't rely necessarily on laboratory workup, but we do this as a way of ruling out.
Yes.
You are not doing this test to find a problem. You are doing this test to eliminate some. Like, for example, you will do a malaria parasite test to rule out cerebral malaria. You will do a scan to rule out a brain tumor. You will rule a thyroid function test to rule out problems of the thyroid. Sometimes we are investigating to narrow down, to know that this is truly a mental illness that is not associated with another problem.
Yes. Going to a counselor and getting therapy, speaking to someone that is a profession, could it help in reducing some of these mental illnesses cases?
When you have a problem, it is good to look for alternatives or ways out. When you have a psychological problem, of course, you need to seek help, and you can start from a psychologist, a clinical psychologist, who will be able to analyze your problem and to have recommendations on ways or how to go about it. They will solve many problems until when they find this problem will benefit from medication. And that is the same way we are also managing the same problem when we find there is a need for counseling, or there is a need to input the effort of a psychologist. We work together. They find someone who wants treatment, they will recommend treatment. We also find a problem, we think it will not only benefit from medication, we also put their input. So it is good when you come in a health facility, whoever is assessing you should give recommendation. They should treat where they find treatment necessary and refer to a professional who will be in a position to give counseling or other psychosocial support, depending with the condition, depending with the illness, depending with the disorder. So it is always good to seek help. You should not die with the problem or let it continue taking part in your life, because it will now, if you are a student, it will affect your learning. It may affect your marriage. It may affect your relationship with other family members. It is better to seek attention. It is better to seek help and have it corrected or otherwise managed. Yes.
Within the shortest time. Before it takes over.
Yes.
Awesome. Amazing. I want you to give people that are watching hope and tell them mental illness is treatable. They should not fear. Maybe. There are so many of us that think maybe it is not. Yes. So maybe you can talk about the treatment. Is it possible? Are there cases that actually get healed and get completely? Yes, maybe as we wind up.
Yeah, that's good. I want to say that different mental illnesses will take different course, and they will also take different time or duration to be managed well, or to be corrected, or to be treated to recovery. You need to continue seeking advice. Should I stop here? For how long should I go with this medication? And that is now another problem that brings about challenges in treatment, because people will ask, for how long will I take this medication? Sometimes you wonder, even if it's lifetime and they are better,
Yes.
other than when they stop, they suffer, which is better. But you realize, with compliance, with adherence, these people who are suffering mental illnesses and on proper medication may not be a lifetime issue, but it may be a lifetime issue when they are on and off medication. So it is good to adhere, to comply, and to subject yourself to help. When you subject yourself, then you will obey and you follow the guidelines, the advice, and this will result or yield to good fruits. There is hope in mental illnesses. When you suffer mental illness, there is hope of recovery. We've had many conditions treated. We've had many people recovering. We've had many people living their normal life even after depression or bipolar disorder. It is a matter of acceptance. It is a matter of reaching out and looking for help. Even if you are treated in this point and you may not have recovered, does not mean the end. You can seek help elsewhere.
Yes.
If you have been managed with this drug for quite some time and it has not helped you, there is another hope for another drug. You know, it is not yet over. It is not yet that over that you will live in that condition. You should seek help from different professionals, and you may one day find your help. You may recover. You may go back to your normal life. It is a matter of seeking help and more help, and also believing, because if you trust that you are stuck in a state that you can't get out of,
Yes.
this is another factor that will challenge healing and recovery. So mindset is another thing to be aware of, and I think people can regain their happiness even when you lost it for a while. It doesn't matter what cost, it doesn't matter how it was, but it is still manageable.
Awesome.
Yes.
Awesome. Thank you so much for giving us hope.
Yeah.
We really appreciate, and I think I have learned a lot on mental illness. Any final parting shots as we wind up?
Okay, I will stress on what I like telling people, that the brain is an organ of the body that can fall sick at some point in life. Whenever you have a problem affecting your behavior, your emotion, your perception, or even affecting the way you do your activities, you should not fear to seek help because you fear to be diagnosed with a mental illness. A mental illness is an illness like any other. A mental illness is treatable. A mental illness is correctable. A mental illness is must not be a curse. A mental illness must not be witchcraft. You should seek medical attention, be analyzed, and that's where you can get help.
Thank you very much. Thank you so much, guys. That is Dr. Akirimi Isaiah, giving us a beautiful insight on mental illnesses. I honestly don't know what you have gotten or what your experience is. You can share. Maybe if you have any questions, you can always get Daktari to answer the questions. If we need help, Daktari, how can we reach to you? Maybe someone has a question, they want to speak to a doctor, they could watch this video and say, I want to speak to daktari. How
Okay.
can they reach you?
You can find me through this number 0713 189 556. We are situated at Middletown, Ghana Street, next to a driving school. The clinic is referred to as Hope Medical Center on Dr. Kiome S. Mwiti Clinic. And you can find me there, or you can find Daktari. We like assessing people physically and not over the phone, because this is a problem that you need to sit down and understand well, and get a history, a good history that you can use to diagnose. Yes.
Awesome. So for now, thank you so much, guys, for finding time and watching our video. We will see you in our next video. If you've not subscribed, please do, and you can also share this information. This is very important information with your friends, and it will really go a long way. Asanteni and goodbye. We'll see you in our next video.